Hello everyone. Today I'll talk about types of epidemiologic research. The first topic is time framework. To get an overview of the epidemiologic research, the key notion is the description and observation of disease or patient in a given time scale. Descriptive observations pertain to the who, what, where, and when of health-related state occurrence. However, to observe and describe health-related phenomena meaningfully, we need to be conscious of time framework. The following three are important: time, directionality, and timing. Time. Time is a measure in which events can be ordered from the past through the present into the future. Directionality. Directionality is the direction of inference of a study from investigators' viewpoint. The direction of a study refers to when the exposure is observed relative in time to when the outcome is observed. In a study with forward directionality, the investigator starts by determining the exposure status of subjects. This is the beginning, and there is not yet any outcome. Then the investigator follows these subjects over time to determine whether or not they develop the outcome. Cohort studies and clinical trials have forward directionality. In a study with backward directionality, outcomes, disease, are already there. The investigator at first selects subjects with the outcome, and then subjects without outcomes. When two groups of subjects are selected, then the investigator asks both groups of subjects about their previous exposures. Case-control studies are backward directionality. In a study with non-directionality, the investigator put much value on the current observation and do not concern about direction. This situation frequently happens when the investigator is occupied by accumulating current data or cases. In this situation, neither variable, exposure or outcome, can be uniquely identified as occurring first. The investigator observes both the exposure and the outcome simultaneously. This is the case of cross-sectional study. Timing. Timing concerns whether the outcome has already occurred before the study actually begins. If the outcome has occurred before the study is started, this timing is retrospective. If, on the other hand, the outcome occurs after the start of the study, then the timing is prospective. Clinical trials are always prospective. Next topic is study design. There are four types of epidemiologic study. Case series. Case series is a collection of patients with common characteristics used to describe some aspects of a disease. If you are a healthcare professional working in a clinic and if you face some patients with similar unknown disease characteristic, you can compile the information of cases and analyze them to learn about the disease. By doing so, you can improve your diagnosis, treatment, and also you'll be able to formulate a new causal hypothesis. If you are an office worker in a district health center, you can compile cases more systematically. When a case series is complete for a defined geographical area, and if the area's population is known, this is population-based surveillance. Next, cross-sectional study. The cross-sectional study examines the relationship between disease or health-related phenomena and other variables of interest, including exposures. A cross-sectional study reveals a snapshot of some outcome, disease, health-related experience of a population at a specific time. Doing the cross-sectional study is convenient and inexpensive. For a cross-sectional study, you need to identify some population you would like to describe and then prepare a questionnaire asking subjects' characteristics, age, gender, etc., outcome situations, exposure information, and so on. Next, case control study. The case control study starts from cases, health outcomes, subjects with the disease. Experiencing a single case is an initiation to know about the disease. Even if the disease is very rare, if you have chance to experience second and third cases, you will know more about the characteristic of disease. However, so long as you study only cases, you cannot go into the etiology, causal factor exposure of disease. In addition to cases, if you have controls, subjects without disease, you can approach to etiology by comparing cases and controls through asking the same question regarding previous exposures. This is case control study. In a case control study, 600 lung cancer cases were identified. Controls were recruited to have the same gender and same age categories. After matching, 1,200 controls were identified. In this study, the possible causes were scrutinized, such as cigarette smoking. For 600 cases, 595 were smokers, and for 1,200 controls, 1,050 were smokers. The case control study focuses on cases, and it does not allow population-based direct risk estimation of exposures. Because case control study work backwards from disease to exposure and do not reveal population information. However, in a case control study, we can calculate at first odds and then odds ratio for the purpose of revealing relative largeness or smallness of risk. To perform a calculation, we at first need to write down the numerical result of a case control study by a two-way table. Odds is the ratio of the probability of occurrence of an event to that of non-occurrence, or the ratio of the probability that something is one way to the probability that it is another way. Odds for outcome yes is A divided by B, and odds for outcome no is C divided by D. For the example of lung cancer study, the odds of smoking among cases is calculated as 595 divided by 5 equal 119, and the odds of smoking among controls is 1050 divided by 150 equals 7. Now we have two odds, and then we can calculate odds ratio. Odds ratio is the ratio of two odds, and in this case calculated as 17. Odds ratio can be larger than 1, equal to 1, or smaller than 1. An odds ratio larger than 1 says the exposure odds for cases is larger than the exposure odds for controls. Odds ratio of exposure can be used to estimate the incidence rate ratio. Next, cohort study. A cohort is a group of people who share common characteristics of experience within a defined period. In a cohort study, you need preventive sense to focus at first on the exposure preceding the occurrence of outcome. In other words, a cohort study has forward directionality. The core of cohort study is to watch large numbers of people over a long period along with the level of exposure, detect and accumulate outcomes, disease, and compare the occurrence of outcomes among exposure level. In a cohort study of walking to prevent coronary heart disease in women, 13,000 women with minimum walking and 14,000 women with normal walking were recruited at the baseline survey in 1986, and occurrence of coronary events were followed up until 1994. During 8 years follow-up, 180 coronary events were detected for exposure yes, and 100 coronary events were detected for exposure no. Then, cumulative incidence is calculated as follows. Number of new cases divided by number of disease-free subjects at baseline. For minimum walking, cumulative incidence equal 180 divided by 13,000 equal 0.0138. For normal walking, cumulative incidence equal 100 divided by 14,000 equal 0.0071. In the real-time situation of cohort observation, the supposition that all persons are followed up exactly the same time period does not fully apply. To follow the reality, the notion of person time is used. Person time is a measurement combining persons and time as the denominator in incidence. As individual subjects at risk of developing the disease for varying periods, person time or person years is more accurately expresses basis to calculate incidence as follows. Person time incidence rate. This is calculated as number of events occurring during the interval divided by number of person-year units at risk observed during the interval. Last topic is trials or intervention studies. trials are studies where an intervention designed to improve health has been applied to a population, and the outcome assessed at follow-up. Trials or interventions are performed in laboratories and clinical studies to establish beneficial effects of drugs or procedures. The trial or intervention study has the similar design as a cohort study. The difference is that the exposure status of the study population is controlled by the investigator to observe how this affects the health status of subjects. Trial or intervention study is essentially an experiment, and typical procedure follows randomized controlled trial. I'll talk about the details in another chance.